Emergency rooms around the state are filling with more and more families who have kids looking for help with anxiety and depression.
Yeah, we've talked about this before. It's become a growing problem during the pandemic, and it's putting a real strain on hospitals. NBC Connecticut's Mike Massaro is live in Hartford. And Mike, what are hospitals saying about this evening?
Well, for example, Keisha, we're here at Connecticut Children's. They say they're seeing about 2.5 times the volume of these types of cases than they saw pre-pandemic. Cases like depression, anxiety, kids with suicidal thoughts. They say that this is being exacerbated by the pandemic right now, just making the situation much more worse than it was before. So now hospitals are looking for solutions and alternatives they can provide to families. Between 40 and 50 cases a day. That's what Connecticut Children's says it's seeing. It's a trend that has been on the uptick for months. The situation has placed strain on hospitals and families alike. Connecticut Children's is welcoming all cases, but says they are not the only option for parents.
Sometimes if it's a really acute issue, going to the nearest hospital is what we would do in a medical emergency.
With hospitals around the state facing similar volumes, the CEO of the Child Health and Development Institute points to another option for help instead of a hospital visit.
If you're under the age of 18 in the state of Connecticut, you can access mobile crisis by calling 211.
Mobile Crisis is a service that people can access by calling 211. Jeff Vanderploeg explains independently licensed clinical social workers will come direct to the situation, usually within an hour.
What they're very, very skilled at is being able to stabilize a very difficult situation and really address the immediate crisis.
The service alleviates strain on hospitals, too.
I think it's helpful for emergency departments because if you can identify children with mild to moderate needs that don't need to touch the ED at all.
Solutions are something hospitals around the state are seeking. Yale New Haven Children's Hospital says it's seeing between 50 and 60 cases a day.
The problem is real, and we are going to have to take a long-term view to be able to come up with solutions.
It is very real, and hospitals are taking it very seriously. Now, you heard about Mobile Crisis talked about there. It's a service that is paid for by the state. It's available to all families, regardless of insurance type, and certainly experts are encouraging people to reach out. You dial 211 and just follow the prompts until you get to Child Services. In Hartford, Mike Massaro, NBC Connecticut News. Back to you.
Mike, thank you. If you or someone you know is struggling, there is help. The National Suicide Prevention Lifeline is a free confidential support for people in distress. The number is there on your screen. It is 1-800-273-8255. That number one more time, 1-800-273-8255.